Heart valves, like those in this beef heart, exist to prevent blood from going the wrong way. During the cardiac cycle, there are moments where blood would move in the opposite of the desired direction, from the ventricles into the atria, or from the vessels, the aorta and the pulmonary trunk, back into the ventricles. Valves exist to stop this. There are two types of valves, and it is easy to distinguish between the two. Atrioventricular valves have an atrium above them, as their name would suggest. They separate an atrium and a ventricle. They are the atrioventricular or AV valves. The semilunar valves do not have an atrium above them. And so if you were a student attempting to identify valves, an AV valve has an atrium above it, a semilunar valve does not. Also note that strap-like or rope-like structures known as chordae tendineae, also it's pronounced and spelled chordae tendineae, these exist only on the AV valves. And so they are very obvious structures that can be used to distinguish the AV valves, which have these chordae tendineae, and the semilunar valves, which lack them. Once you have identified a valve as an AV valve or a semilunar valve, the right AV valve separates the right atrium from the right ventricle and is also known as the tricuspid because of its three cusps. The left AV valve separates the left atrium from the left ventricle. It is also known as the bicuspid or mitral valve, the bicuspid because it has two cusps. In the semilunar valves, each is located at the base of a vessel, not an atrium. The aortic semilunar valve is at the base of the aorta, separating it from the left ventricle, while the right AV valve is at the base of the pulmonary trunk, separating it from the right ventricle.